And I think, are people on now, Felipe? Yes, okay, well, hello everybody. Welcome to our 7th annual Entrepreneur Challenge, the second online and hopefully the last, as we really hope that next year we'll be able to meet in person. This year, we received a record number of submission. Just to give you an idea, we received 45 projects. And after a very tedious review, the selection committee picked the 3 very best projects. So I'd like to congratulate our 3 startup companies that are going to be pitching very soon. For making it. It's already a great achievement. Congratulations. To the audience, even though you will be initially muted, you will be able to vote for the audience award, and of course you will be actively involved in the networking session right after the awards. Feel free to share to open your camera, and last, I would like to to thank first of all the organizing team who set up the event during the past few months. It's been a great job, and I would also like to thank our jury members who have accepted to spend some of their time to look at these innovative projects through their lenses. Thank you, guys. I would like to also thank our last year winner, who will give us an update later on. I would also like to thank our sponsor, Ramit Yourself, our benefactors who contributed to the prize money, and last but not least, I would like to thank our MC, Véronique Hamel. So I'm just going to say a few words about Véronique, even though most people know you, Véronique. But so Véronique is an alumni from EDEC Business School. She is the general manager at TerraSend, a publicly traded cannabis company with operations across North America. As such, she reports to the chairman of the board. And prior to TerraSend, Véronique has had various senior executive positions in Europe, US, and Canada, mostly in CPG and pharma, with always a strong focus on innovation. And fun fact about Véronique, besides enjoying the cottage life in the Kawatas, Véronique has a passion for the French region Vendée, as she loves the serenity of its geography and inhabitants, as well as the vibrancy of its economy. Véronique, the floor is yours, and welcome.
Thank you, Bruno. Thank you. I'm so honored to be the MC this year. It's such a fun and productive event, and I'm always blown away by the talents and the energy that there is in Toronto as far as entrepreneurship is concerned. So the agenda is pretty simple. And before I start, I want to thank again Ramit Yourself. That's a great sponsor that we have for the evening. I was intrigued by some of the cocktails. One that intrigued me the most was BSAP, because on the website I can see there is some therapeutic virtues in drinking BSAP. So now I have a good excuse to do so, even during meetings. I can say it's for therapeutic reasons. I encourage everybody to buy some samples of Ramit Yourself. It's a great entrepreneur leading that company, and accepted to be the sponsor this year. Pretty exciting. So our agenda is obviously, I'll start introducing the jury members one after the next. And all along the evening, you can count on Felipe for anything technical. He will always explain to you how you can be proactive and ask questions. And I'll make sure that your questions are forwarded to the presenters. While the jury will be deliberating after the presentations from each finalist, we will have the pleasure to listen to the testimonial of last year's winner. And that will lead us to the announcement of the Grand Award. And it's very important, that's probably the best of all awards, the Audience Award. And we will be able then to network and meet each other and comment on all the great ideas that we have been exposed to during the evening. So Felipe, maybe you want to explain a tiny bit how to proceed with the questions?
Sure. If you can just move to the next slide, please. So just before I talk about the question itself from you to the finalists, let me just talk about a little bit about the speaker view. So that's just a feature on Zoom, if you're not familiar with, in order to be able really to see in big screen whoever's speaking at that moment. Well, when there's a presentation in the background, that won't make much of a difference, but when you're during the Q&A, that will make a bunch of a difference for you. So if you're using the web version, so if you click from the join from browser or you join from your mobile, you should be already okay, so don't worry about it. But if you use join using the Zoom desktop application, just make sure that you do what I'm going to explain now while I'm talking, so you're going to have the best experience during this event. So on the top of your screen, just go up and there see the view options. So just click it there and then click it on the option C, side-by-side mode. Once you have done that, there will be an option that will appear on the corner on the right of your screen. It's going to be the speaker view. So just click there. And once you click it, it should be already good. So you should be having always a good view of whoever's speaking at that moment. All right, so that was basically it for myself for this slide. I'll come back to talk to you for a second and just after. But if you have any technical difficulties during the event, just send me a message and I'll be able to help you. Veronique, I'll pass you over back to you.
Okay, so thank you, Felipe. It's time to introduce our juries this year, and I will start with Audrey Urso. Audrey Urso, she's Chief Financial Officer of Rexall Canada and member of the Executive Committee since 2018. For those who don't know, Rexall Canada is a leading distributor of electrical products, delivering quality products and high quality services to customers. Few figures for Rexall Canada. It's about 2,000 employees and more than 1.5 billion in sales. Audrey holds a diploma in management and economics from EDEC, so she's a colleague of mine as far as alumni are concerned. Audrey moved to Canada 4 years ago with her husband and 3 kids, 1 daughter and 2 boys. In her spare time, Audrey enjoys traveling. She's fond of winter and all the wintry activities, cross-country, skiing, skating. So as such, she's becoming every day a true Canadian. Welcome, Audrey. You want to add a few words?
Maybe later on. Thank you for the intro.
Okay. So let me introduce now Lauren Raffeson. Lauren Raffeson is partner, growth equity partners at BDC Capital at the Toronto office. Lauren has 15 years experience in private equity and corporate finance and has worked and lived in North America, Europe, and Asia. Lauren currently serves on the board of companies such as Firmex and Investor.com. He previously served on the board of RX Drug Mart, and at BDC Capital, he enjoys helping Canadian companies scale globally. Before joining BDC Capital, Lauren held roles in several independent investment management firms, as well as the merchant bank and the investment bank of 2 large Canadian financial institutions. Lauren received a BBA with distinction from Schoolish School of Business at York University and an MBA from INSEAD. In addition, he is a CFO chart holder. And one of the fun facts, Lauren has traveled over 40 countries. I will be intrigued to have the list of those 40 countries, but I don't think we have the time tonight. So welcome, Lauren.
Thank you, Veronique. Nice to meet everyone.
And our third jury is Peter Traynor, president of Reonard Real Estate Group and capital markets consultant. Peter has worked both directly and by contract for all 3 stock exchanges in Canada, as well as the country's principal securities regulator, the Ontario Securities Commission. While not a lawyer by trade, he has both succeeded lawyers in corporate roles and has been succeeded by them on his departure several times. Suffices to say, he has been steeped in the regulatory compliance aspect of the capital markets over the course of his career. And his fun fact is, having been an amateur radio operator since his youth in the late 70s, Peter is adept in the ancient discipline of Morse code that may come in handy when the cyber world one day inevitably collapses. SOS. I think that's an evening by itself, Peter. We can discuss the longevity of the Morse code at length. So welcome, Peter.
Thank you very much for the introduction. Look forward to interacting with all of you, or as many as possible, and hearing about these 3 fine companies. So thank you.
I don't know if you noticed, but this evening, the jury skews finance. And we all know that when you are an entrepreneur, finance matters. You really need to build a network of finance people around you to succeed. So no surprise there. So Felipe, do you want to add something at that point?
Yes, thank you, Veronique. If you can move to the next one, perfectly. So although you'll not be able to unmute yourself during the presentation, only after, of course, during the networking part, you'll still be able to send your questions to the participants. And to do so, actually, I'm going to ask you to send them to Claire. So Claire Cornell is going to be compiling those questions and then passing over to Veronique, who's going to really asking the questions to the finalists after their presentation. So you can feel free to send the questions to Claire during their presentation to wherever you want to ask them, the finalists. In order to do that, just go to the bottom of your screen and click on the chat. And then it will appear on the right, you'll see an option. Going to be clicking on that down arrow and selecting to send the message to Claire. And whenever you do it, just make sure that you're saying to whom, to which finalist is the question. Just make sure that we're asking the right finalist the question that you sent us. And that's basically it from my side. I'll pass it over to Veronique.
Thanks, Felipe. So I think the evening is really starting now because it's time to introduce our first finalist. So the first finalist, in fact, is a team, and it's Anneke van Heaven and Elias Trouillet. Anneke and Elias graduated with a degree in nanotechnology engineering, where they developed the technology, which is the basis of the company AAGEF. They have a passion for biotechnology, as you may guess, and green technology, which inspired them to create this non-toxic flame retardant. I asked each of our finalists, what do they like the most of being an entrepreneur? And their answer was, the favorite thing about being an entrepreneur is designing a solution to a real world problem that will make a difference and improve people's lives. It's so true, and I think it's time for you to explain to us what your project is all about.
Thank you for the introduction. I will share my screen now. There we go. All right, there we go. Yeah, so thank you for allowing us to pitch tonight. This is a great opportunity. My name is Anneke van Heaven, and I am the CEO and co-founder of AAGEF.
And I'm Elias Trouillet, CTO and co-founder of AAGEF, where we are developing the first non-toxic based flame retardant. Did you know that you spend about 22 hours per day exposed to toxic flame retardants? These chemicals are found in household items because they are a necessary fire safety measure. However, they can cause fertility complications, brain development issues, and cancer. And many of these chemicals stay in our environment for over 1 million years, leading to accumulated exposure. Over the years, many flame retardants have been banned once enough toxicology data is collected. We believe that the flame retardants currently on the market will likely follow this trend. In fact, Canada released an action plan on August 2021 to phase out 12 more toxic flame retardants, and another 16 are under investigation. Also, in June 2021, New York passed a bill banning certain flame retardants found in furniture, mattresses, and electronic casings. This is all evidence of increasing regulations surrounding flame retardants. The common trend among chemical companies is that when a chemical is banned or restricted due to its toxicity, they use another chemical with a similar molecular structure and therefore similar toxicity, or they use a lower concentration of the same banned chemical in order to be under the restriction threshold. However, both of these solutions are temporary fixes for companies who could get their product banned and for the public as its health and safety is still at risk. This is where AAGEF comes in. We have developed a patentable, non-toxic flame retardant made from a biopolymer and nanoparticles. This product can be easily applied to textiles used for firefighter gear, furniture, baby clothing, mattress, vehicles, and more. We can assure that our flame retardant is non-toxic because it contains 0 VOCs and uses readily available materials already found in FDA-approved products. As you can see in these images, our flame retardant coating significantly improves the material's ability to suppress fire. Our coating not only inhibits the spread of fire, but it also prevents melting plastic from dripping, reduces the amount of smoke, and helps the material self-extinguish the fire. We've conducted the industry standard vertical burn test on textiles coated with our flame retardant, in which we measured a char length of 3.75 inches, surpassing the industry standard of 6 inches. Here is a quick demo of that vertical burn test.
As you can see here, our coating does make a big impact. So our obtainable market is the North American flame retardant textile market, valued at $92 million. And this market needs our solution now because the public is pushing for greener solutions, and it is estimated that the flame retardants currently used in North America will be banned by 2024. And our customers have expressed their need to get ahead of these regulations. We will then have the resources to expand to a global market, and our future vision is to alter our product into a powder additive form and also sell it to the flame retardant plastics industry, valued at $62 billion. Now, the average flame retardant costs $26 per liter, and at scale, ours costs $4 per liter to produce, which leaves plenty of room for profit. Our flame retardant coating is also applied with the same processes that are currently used in manufacturing textiles, which makes it easily adaptable. And we plan to sell our coating at the market average while it has the added benefit of being non-toxic. One customer in this space typically produces 1 million yards of textile every week, and they would need approximately 122 milliliters of flame retardant to coat 1 yard of fabric. If we could just capture one customer, we would fill their needs with 122,000 liters per week. And at the average price point of $25 per liter, we could be making a weekly revenue of $3 million. Now, some of our competitors include some larger chemical companies like 3M and BAFS Chemicals, who are starting to devote resources to R&D and finding biosolutions. However, our advantage is that we already have a working technology for a low cost, and ours is made from renewable resources. Other competitors are some small flame retardant companies in niche market segments, developing non-toxic flame retardants in a coating form, but no one is working on a powder form, which has way more market opportunity. And we not only have an untapped market of non-toxic flame retardants, but we have the potential to expand into the tapped chemical market and grow to an annual revenue of $59 billion. So we have conducted at least 24 customer interviews and plan to do more. And all of the government officials, firefighters, and chemical companies we've spoken to all have the common opinion that there is a desire for our solution. We've had serious interest from 4 potential investors and have an ongoing relationship with 10 companies who want to test our product with their materials in hopes of being a future customer, including some global suppliers of flame retardants. We are currently collaborating with 2 potential partners who have sent us samples of their textiles for us to treat with our flame retardant and send back so that they can perform their high-level testing on our product. One of which has already expressed their interest in using a 100-kilogram pilot batch of our flame retardant on their textiles in their manufacturing line. And we hope to grow these relationships and eventually fill all of this customer's needs. So through multiple customer interviews, we've identified the required tests that our product must meet in order to be introduced into various markets. The most important tests that all markets need are the ASTM vertical burn test, manufacturing compatibility, ISO adhesion test, the REACH toxicity standards, and a shelf life test. Now we've ensured that we have or will meet all of these requirements, which will allow us to start selling our product to industries in household goods, such as furniture upholstery, curtains, and carpets. And we are currently conducting the ISO adhesion test, but based off the visual and handling of our product to date, we do anticipate passing this test. We've also conducted a 2-month shelf life test at room temperature and can assume that it will also have a shelf life of 1 year based off of its antibacterial product aspects in our product. However, to ensure that we do pass this test, we are currently conducting the standard simulated test of 1 month at 50 degrees Celsius. Now, if we wish to expand into the clothing industry, we must also pass a wash fastness test and the OEKO-TEX 100 standard for skin safety. And we have conducted a test that simulates the condition of 40 washes, but we are currently sending samples to a potential customer who's going to perform the 40 wash test for us in their facilities. Finally, we are also looking into the requirements for the OEKO-TEX 100 test and reaching out to third-party sites to perform this testing for us. Now, up to this point, we have been self-funded, but we are looking to raise a seed round of $1 million to sustain us for 16 months. This money would enable us to get our flame retardant coating to market faster, funding our first 100-kilogram pilot batch with one of the partners within 6 months, allowing us to send our first invoice. We then plan to hire an experienced employee in business development to build those key partnerships and acquire new customers. Then we will conduct the industry standard third-party certifications like NFPA and CGSB, which are not required to sell our product, but it will attract new customers and show our product's validation. Alongside growing our coating sales, we plan to hire a senior technical expert to focus on the innovation efforts of developing our coating technology into a powder form. And that can be used as an additive, which will open up a whole new market segment. And we are the right team to solve this issue. So we've all graduated from nanotechnology engineering. We have an extensive amount of nanomaterial experience and the technical skills required to build a product in this field. I personally have experience working at various startup companies, which has given me exposure to early product development and the startup grind. Elias brings a technology edge to the team with his tremendous research and development experience. And Tessa possesses knowledge in business operations and product lifecycle management. Now, we have graduated from the Concept Pre-Accelerator program, have been recognized as the National James Dyson Award runner-up in Canada, and have made the international top 20 shortlist out of 2,000 applicants. We've recently been announced as the winners of Les Innovateurs Pitch Competition, and we are now participating in the CDL Accelerator program in Toronto, which provides us with priceless mentorship. We are also surrounding ourselves with industry experts like Paul Hardy, who has worked in the chemical industry for over 20 years and is now a flame retardant product line manager, and Quincy Emmons, a former firefighter and fire chief, who is now president of his own company making non-toxic fire extinguishing foam. Our vision is to eliminate toxic flame retardants everywhere. We're AAGEF, keeping you safe in more ways than one. Thank you for listening.
Thank you, Anneke. Thank you, Elias, for this presentation. It's time for question. I will start my ask Audrey from the jury if she has a question.
Yes. Thank you, Anneke. Thank you, Elias. Actually, I have 3 questions, so maybe I'll start with the first one. Any protection, I mean, on this innovation, any patent you need to formalize to protect your innovation? That would be my first one. The second one being, can you elaborate a little bit more on how advanced you are on the relationship with potential customers to be able to achieve this 16 months, where you said after 16 months you'll be able to invoice your and bill your customers? And the third one being, what about the innovation and in competitors? You mentioned a bit about the competitors. What would be, what do you know about them, and where would they be as well on those type of algo innovation as well? Thank you.
Yeah, so to address the first part, we are filing a provisional patent. It's pretty much written up, and we will be filing that in the coming weeks. So we have had a lawyer write that up for us, and that does protect our specific formulation and the applications that it can cover. As far as the progression of the relationship with our customers, so we do have an ongoing relationship with about 10 customers who have expressed the desire to test our product in the future. With 4 of those customers, we have received samples of their materials and we're in the midst of coding them and sending those samples back. So once they perform their tests, we'll then be in the position to start that pilot batch, which 2 of them have expressed their desire to be like a partner with us and do kind of that scale up batch testing. And then the innovation from competitors. So we haven't found specific innovations in the flame retardant side of things, but a lot of textile companies are trying to find like greener solutions. So one example is Tencat recently came out with a new textile that uses more sustainable fibers. However, not many companies or anyone we found has a solution yet for like a greener flame retardant. So they're trying to get a greener solution, but they haven't found one specifically for the flame retardant aspect yet.
Thank you. So any question from Lauren?
Yes, I guess a comment and a question. So just on the last point around competitors, clearly I'm talking about the large global players are very well funded, very well capitalized, have been in the, textile coatings market for decades. I think in my mind, it would be very easy for them to pivot and allocate resources to it if they saw, a large enough market. So I guess the comment is it's worthwhile kind of following closely what they're up to. At the same time, I guess they could also be a potential exit option if you build this company, down the line. I guess which leads to my question, which is really around your addressable market. So you presented data, I think it was 92 million North America, which feels a bit small, especially relative to the global market. And I would assume that's because most textile production occurs outside North America. So the question is really on your go-to-market. How are you planning to address that given a relatively small TAM? You threw a stat up, I think 3 million a week revenue, which would lead to 150 million top line with a single customer, but the market in North America doesn't support that if it's 92 million. So how are you planning to, I guess, go global or go to market in a more international fashion to tackle a larger TAM?
Yeah, so that initial TAM number, like the 92 million, is specifically for only flame retardant textiles in America. So the entire flame retardant market is closer to 7 billion and the entire textile market is closer to 2 billion. But this is specifically like the combination of those 2 markets. But we are talking to a lot of companies currently in Europe because they have a large market there as well. So we're talking to 2 different textile companies who Two of them are actually the ones we've sent samples to. And I think having them as like one of our key partners to help us like get introduced into the market is kind of our tactic there. And they also are manufacturing in Europe, but they partially do ship to North America.
Okay, so you're starting with a European approach first. Okay, that's great.
Okay, any question from Peter?
Yeah, I had, I just wanted some elaboration on the powder additive and why that is a, you know, an effective, I guess, branch of selling. Also sales and marketing, you know, how are you getting it out there? Are you pre-selling, or is this a product you can deliver tomorrow? As well, I think $1 million over 16 months is easily burned through. I think it should be 3 million, but that's something we could drill down into. Those are my comments.
Elias, if you want to comment on the powder form, and I can take the other two there.
Yeah, definitely. So the powder form is something we really would like to branch into, because with the powder form, we could incorporate our product into plastics. Plastics is a much larger market. I think it has a valuation around $95 billion. And then we can, so by doing that, we could expand and branch out and definitely generate some more revenue. So that's something we definitely want to do in the future, and hence why we would like to, as a milestone, hire someone technically that's relevant in this sphere that help us with those connections and develop our market there.
Yeah, and as for delivering, say, our product tomorrow, so like I mentioned, there's a few minor tests that we're still performing to validate our product. And we have talked to like manufacturers about the efficacy of scaling our product and manufacturing it. But I think the thing holding us back on that front is just actually performing that scaled test. So that's why we're hoping to work with one of these customers in the next few months to do that like smaller 100 kilogram pilot batch before expanding up. And at that point, we could either be manufacturing and sending our product, or licensing RP to potential customers so that they can manufacture on site. And then as for the raising of our seed round, that is an estimate kind of based on the chemicals we would need to do some of these pilot projects and do our R&D, the hiring we plan to do in the next year, and things like that. So, and including rent, patent fees, lawyer fees. So there definitely is some room to expand there, but that's kind of the estimate we've just come up with so far.
Understood. In principle, triple the raise and cut in half the time. So it's just
okay.
Something that happens. Anyway, good stuff. All good.
Thanks.
Thank you.
Claire, do we have any question from the audience?
Yes, I don't know if it's planned for right now, maybe after the presentations, but I can send you to the chat, actually them to you right now if you need it.
Yeah, we have a few minutes, so maybe let's give a chance to the audience to get their questions. Okay, so I have a question from Jerome. Does the IP belong to the company or a founder?
So the University of Waterloo is in a pretty unique situation in which anything that is developed on the grounds, as our technology was, is the university doesn't take any ownership to it. And we are currently ensuring that it is fully ours. So we will be initially ours, but we're going to assign it to the company as soon as we have the university has waived its rights to the IP. It's very procedural. It's something that happens very often at the University of Waterloo. So we're going to have like full ownership and then transfer it to our company within the next few weeks.
Question from Linda. How long will the flame retardant last in the wash?
Yeah,
that's something we are still testing. we are going to send, as Annika mentioned, our samples to some customers so that they can perform these kind of testings, because it requires a very specific machinery to which we do not have access at the moment. But we've done some simulated testing, and the results are pretty good. And it is a requirement for part of the market in which we're interested, but not all applications require as an extensive ability to sustain the coating under washing, because the product won't be exposed to this kind of environment as often. But like I said, for those markets for which we are interested in and that require some washing, we have sent our samples to some companies that can do this testing in a more standardized fashion.
Thank you. I have a question from Hervé. It looks like the potential is massive. How are you planning to scale productions? With what partners? Where will it be produced, etc.?
Yeah, so the initial scale test that we want to do is with our partners right now, in that 100 kilogram pilot batch. And then from there, we have talked to some manufacturing facilities to ensure that they can produce larger batches on the scale of thousands of kilograms. So we know that the machinery is there to scale our product. It's just the fact of physically testing that scaling and slowly testing, making larger and larger batches. But we plan to manufacture here in Canada or America and kind of ship from there.
Okay, we have 3 minutes left, so I'll try to squeeze as many questions as I can, because you receive a lot of questions, which is a good sign. So Pragya, can you elaborate on your marketing plan?
Yeah, sorry, was it?
The question is on the marketing plan. Can you elaborate on your marketing plan?
Yeah, so what's great in this industry is that because we're B2B, we don't really necessarily need a lot of customer marketing to like the public. But the way we're going to market is by just building our relationships with these key partners. So we will kind of be going to the partners and showing how our product can help their marketing team be portrayed as more green and eco-friendly and things like that.
Okay, thank you. I'll park the other questions for later, and I will go back to our jury. It's your opportunity to ask more questions if you want to.
Yes, I may. So you mentioned the operation. I mean, either you're going to manufacture in Canada, but you were also talking about Europe. You also contemplate to potentially let the customers somehow manufacture a piece. What's the best business model for you?
I think because we would have potential customers in 2 different continents. I think a hybrid model would essentially be what we would go for initially, because we wouldn't have the facility to manufacture everything in-house. So we would most likely license our IP and our expertise to the customers that we have in Europe so that they can produce it in-house. And then when it comes to Canada and the US, then we would manufacture it ourselves and then ship it to our customers.
Are you giving away some margin if you let your customer manufacture and transform? Do you feel?
Possibly. That's something I haven't really considered, to be honest.
Okay. Thank you.
Any other questions from the jury? We have 1 minute left.
Do you have a sense of, I have a question. Do you have a sense of how other jurisdictions are regulating flame retardants? Is it similar to North America, or are there certain countries that are leaders in the space that you could potentially target first?
Mm-hmm. So in terms of like Europe is much more advanced in terms of those regulations. There is a much more extensive restricted substance list in Europe. So there's they would definitely be a leader, but there is like I mentioned, there's a growing movement and need in the industry for a greener flame retardant. Even in North America, Canada is in the process of eliminating brominated flame retardants. So that's why I think Europe would definitely be a very interesting initial customer for us. And it would also, in a sense, require less investment if we started our business with Europe, because we would most likely start licensing our IP and they could do the manufacturing on their end. So the initial investment wouldn't be as significant. But we do hope that as time progresses, there are going to be more regulation and a more established framework for the introduction of new chemicals in North America, as we're starting this to see a bit of its skeleton in Canada. I hope that answered your questions.
Yes, thank you.
Thank you. I believe we came to the end of the question window from the jury. I think it's time for me to introduce the second finalist, Felipe.
Correct.
Okay, so let's roll. And the second finalist is Hamza Sheikh. Hamza is the CEO and co-founder of Stable. I hope I pronounced it right. Before launching the startup, Hamza spent 4 years at EY, it's Ernst & Young, working in the private sector while earning his CPA designation. His experience working with digital health startups supports him as he launches the sleep cycle for surgical recovery. When asked what does he like the most about being an entrepreneur, Hamza answered, the daily challenges that come your way and force you to grow in all aspects of your life. Stable has given Hamza the opportunity to develop his professional and intrapersonal skills by growing his network, strategically launching his business, and executing tasks consistently. It's time for you, Hamza, to say all you have to say about your great project.
Yeah, let me just share my screen. I'm definitely probably have changed my answer to that. I don't think I like these challenges as much as I thought I did when I was answering the question. It's just too many of them.
Well, that's life. It happens.
But yeah, for sure. Let me know when I'm ready and I can go from there.
Perfect. You can go now.
Awesome. Hi, I'm Hamza, the CEO and co-founder of Stable, a digital health platform that's removing post-op rehabilitation from the clinic to the patient's living room. Last year, my 13-year-old cousin had ACL reconstructive surgery after blowing his knee out playing basketball. And like most patients, he had a great time. But on his way out of the hospital, they gave him a whole stack of discharge documents, including a bunch of exercise he had to do at home immediately to make sure his recovery timeline was on point. But his lack of adherence to his post-op recovery extended his recovery timeline by 3 weeks. Like most patients, a lot of his recovery was done in the hospital setting. And during this time, my aunt was unfortunately exposed to COVID. This sparked my interest to launch Stable to make sure a patient is able to recover from the comfort of their own living room, but still keeping them connected with their medical team at the hospital. But my cousin wasn't just a one-off scenario. In fact, last year, over 5 million patients failed to adhere to their post-op recovery programs. And a recent study interviewing thousands of them identified 3 common reasons why. Inconvenient exercise programs that don't fit a patient's lifestyle, a disconnect with their surgical staff at the hospital, and no visibility or insights into whether they're progressing through these recovery exercises at all. Poor surgical recovery is costing hospitals over $27 billion every year in the form of patient readmissions, federal fines, and $200,000 of lifetime value for every patient that's dissatisfied and chooses a different medical provider. Stable is here to solve all of that. We're a post-op physical therapy platform focused on patient adherence. Our platform creates custom recovery programs for each patient, facilitates daily rehabilitation sessions, and shares insights and progress to keep the patient engaged. We're able to do all of this by using live motion analysis on just a smartphone or a laptop camera. We're able to recreate a clinical setting in the patient's living room. We're able to analyze their biomechanics and range of motion in real time and give them the same oversight a clinician would in person as they're recovering from home. And to make adherence 3 times higher than what it already will become, we share all of the patient's progress back to the medical team at the operating hospital. Now, unlike alternative solutions on the market, Stable maximizes the patient-provider relationship that no other solution is able to do. They either isolate the patient using an artificial intelligence-based coach, or connect them with an orthopedic surgeon or provider that they have no relationship with. Now, I can't speak for everyone on this call, but I've yet to walk into a medical office or a clinic that I have no relationship with this doctor or provider. I still go to the same barber since the 10th grade, so the idea of connecting with someone I don't know doesn't seem like a plausible solution to this problem. Now, our value proposition became so promising that the largest health system in the United States is collaborating with us today to co-develop and design our solution. The United States Veterans Health Affairs has over 600,000 orthopedic surgeries every year and 1,200 facilities spanning across the nation. Today, we're in a collaboration with 3 of their hospitals to co-develop and design our solution and work closely with their medical staff, patients, and clinicians to ensure our solution fits a clinical workflow. We've also identified key milestones in this relationship for us to hit to convert this into a paid pilot opportunity in all three of these hospitals. And with the potential to convert these hospitals into customers, has upwards of $25 million of annual revenue for us as we look to expand within the system. However, along with the public sector, we're targeting private hospitals across the US as well. With our involvement in key healthcare accelerators, we've been able to validate our business model with industry experts. An initial annual licensing fee, depending on the size of the institution, coupled with a per patient recovery fee we charge, we're able to maintain a consistent cash flow throughout the years, but still maintaining industry averages in sales cycles and costs. At every stage of our go-to-market strategy, we have key relationships with industry experts that are allowing us to facilitate conversations and open a lot of the doors for us. This includes ex-executives at Kaiser Permanente, Vizient, or other large healthcare systems across the US. We are also involved in local Toronto-based healthcare accelerators, allowing us to build relationships with hospitals here in Canada as well, as we target both markets simultaneously. As the CPA and CEO of our company, I have vast experience working with digital health enterprises. My 4 years at EY gave me the experience hand-on to strategically look at the market and identify key opportunities that Stable is now exploiting to become leaders in this industry. I'm a previous health and wellness small business founder and have been a personal trainer for the past 7 years, focusing on clients' recovery from injury and functional training. Abhinav, our CTO, was a full-ride scholar to the University of Toronto with a degree in computer science and mathematics. He was a previous startup founder for a company which was then immediately acquired as soon as he graduated, and currently a senior software engineer at Laser Technologies. He has experience working in AI and blockchain with his time at IBM, and he's leading the development of our product. And behind us is a team of successful advisors, helping us navigate through this complex industry, ranging from a physical therapist that has experience working in the Olympics, a medtech startup device founder, and a VC specializing in growth. We also have expertise in cloud transformation and healthcare commercialization. Today, we're fundraising a $400,000 pre-seed round to allow us to get the quantifiable metrics from the opportunities and pilots we have in place right now. We'll also be able to complete development of our product and be fully compliant with any healthcare standards required in the US and Canada for us to scale and grow immediately. I'm happy to answer any of the questions that you might have across the panel, and I have opened the floor for any of them.
Thank you, Hamza. Thank you very much. And I'm sure our panel of jury has questions for you. This time I will start with Peter. Peter, we can't hear you.
Forgive me, I was muted. Forgive me. Thank you for the introduction to the company. Wonderful. Can you elaborate on the sales and marketing plan, starting now, presumably, and going forward? Thank you.
Absolutely, yeah. So we currently already have our foot in the door in the large US health system, the Veterans Fair, coupled with a lot of private institutions across the US that we've been able to secure in our pipeline. We just have to complete the product that we have to transition those into pilot opportunities. Our involvement in the Ryerson Biomedical Zone Accelerator has given us close access to St. Michael's Hospital in Toronto, where we're working with clinicians there to start piloting within that hospital as well.
Terrific. Okay. Do you have a sales staff?
We don't. I am the sales staff.
Okay. And you should be, all right? The founder should be.
Yeah.
But you've got to obviously flesh that out. in terms of raising money, what are you doing?
Well, we're at this event now. We're connected with a lot of VCs in Toronto through our relationships with the accelerators and through the Founders Institute Accelerator Program as well. We're also connecting with those in the US as we're able to target both markets. VCs are really interested on that side as well. The whole point and usage of those funds will give us the pilot metrics we need to kick into the stage and commercialize immediately, at which point we will bring on that healthcare sales expert like we mentioned before.
Got it. Thank you very much.
Okay, so Lauren, do you have some questions?
Sure. I guess, you mentioned good traction in the US and just kicking off in Canada, I guess. The question is, can your product exist in a public healthcare, single payer system? Or is it really a tool that is best suited to a private model where you've got more value-based delivery and probably a more personalized care plan?
Yeah, so we definitely, that's why we're starting in that market. They're a bit more forward focused on solutions like this. We can exist in the public market. We've been able to validate that with clinicians here. It's just more of the top line of the hospital that's going to be utilizing it. However, it does provide more value for the insurance company just as much as the hospital in the Canadian market to incentivize patient recovery and timelines.
Right. I guess a separate question is, I guess through COVID, we've seen the emergence or acceleration of a number of virtual telehealth platforms of sorts. So, what doctors swore could only be done physically is now being delivered virtually in all manners of forms. And there's all sorts of companies, public, private, that are trying to tackle different solutions. So I guess the question is, have you thought about potentially partnering with one of those platforms, given, I guess, you're targeting a fairly narrow kind of point solution for, post-op recovery, seems like orthopedic specialty focused, as a means to accelerate growth?
Yeah, so we've started off with the niche, like you said, orthopedics, with our full TAM encapsulating both cardiac rehabilitation as well. That's part of our exit strategy as opposed to partnership to scale, as a lot of these companies are going to be looking to enter this market as it grows with the aging population and the use case. Once we've established our niche, we expect to really be acquired immediately after.
Okay, great.
Audrey, I'm sure you have questions.
Maybe some clarification to make sure I understood. So the 250K, is that sales you generate today?
The 250, no, that's the potential of the pilots that we have with those 3 hospitals.
Oh, okay, sounds good. I have another question, more so with data privacy. I mean, those are big topics people talk about. You will deal with kind of health private information as well. Anything you're doing on the security side?
Yeah, absolutely. So the funds that we're raising right now will allow us to get our full HIPAA compliance license, which is all the patient data will be secured, meeting all regulatory requirements in both US and Canada, which are extremely stringent, but we're able to expedite that whole process.
Okay. Thank you. And no, I think that's it for now.
So any other burning questions from the jury? Otherwise, I can give you a pause and ask questions from the jury.
Maybe just to a question that Peter alluded to as well on the workforce, because if you want to penetrate the market, what's your investment in down the road on the Salesforce side? I mean, do you contemplate to build a team as well, or how do you see this?
Yeah, absolutely. So we don't look to invest and build up a whole sales team. A lot of the connections we have in both US and Canada are with these top level organizations that own multiple hospitals across the US. So us targeting one of these organizations where we have a warm intro to, will get our solution upwards into 1,500 hospitals across the US. So it's a faster scaling opportunity for us to really exponentially grow without having to invest in a full sales company.
And also a question also on some numbers. You mentioned $500 per patient, right? How did you came to this number? How much that give you at the bottom?
Yeah, so we took the average cost of post-op recovery ranging over 1,200, and then we accounted for our hosting costs and overall the usage of our platform for a patient over 90 days, which gave us a profit margin around 500. Which gave us a profit margin when we priced it at 500, and then we validated that with industry experts working in a lot of these finance departments in the hospitals and in the insurance side, as this will provide value for the hospital, and they'll be able to pay for it without having to extensively decide, but also on the patient side as well.
Thank you.
Quickly, how do you get paid? Does
The hospital pays
bill
us.
that to you upfront, or how does it work?
Yeah, so we have an annual license with the hospital, depending on how many medical providers they have in there using our platform. And that's like our long-term license and our big check amount. And then we have every patient's recovery we manage over 90 days, we bill on a monthly level to maintain cash flows throughout the years.
Okay, thank you.
A question on the patient side. So if I look at your app, it seems to be mostly mobile based. Do you have data on usage statistics or even age of the average patient?
Yeah, we're doing that right now with the VA. A lot of their patients are elderly, and they're in that Veterans Public Health System. So it'd probably be the best replication of Canada as well, where we're working with testing out the design of our platform so it's usable for them, and we're also keeping metrics of it.
Okay, because I guess my concern would be, not everyone uses a smartphone.
Yeah,
the target audience. Okay.
Okay. While you think about further questions, esteemed jury, I will ask questions from the audience. And one is from Scott, and he's asking, what's the T and the W in your SWOT over next year?
The T and the W. So the T would be companies seeing the value of our solution, using the same live motion analysis. That's one of our full IP security levels. And the additional is those that use live motion analysis, they don't have that patient provider relationship that we're able to establish going straight to the hospital in the sales cycle. So their whole market would have to change for them to kind of address the same problem. The weakness side of things is the regulation and the kind of the bottleneck behind healthcare sales. Like I said, I'm the only salesperson. I do have a lot of strategic experience. So it is one of the things I'm overcoming. However, it's just to build the initial traction, to build a team with someone who's an expert to come in and address that.
Thank you. I have a question from Hervé. Have you tried this solution with a real patient with a prototype to make sure that the objective of adherence to the recovery schedule is achieved?
So that's the pilots we're running right now with the VA and another private institution in the US. We're able to get the metrics on adherence and go from there, which will play a big role in our commercialization against alternatives. We have run trials with patients receiving telehealth physical therapy to address the accuracy of our platform, where we ran 200 trials over 10 days and came in within 1/10 of a degree on range of motion analysis compared to manual hardware alternatives that they use.
Thank you. I have another question from Madhu and David, both the same. Who is your major competitor?
Our main competitor would be Hinge Health, a hardware-based solution out of the US. They are the ones that connect a patient with a medical provider within their organization that you have no relationship with. It's our vision and strategic analysis of that they can't address the solution as well. And they're also mostly focused on joint and chronic pain, whereas post-op care is kind of their secondary or tertiary option.
Okay, before I go back to the jury, I will ask another question. Madhu wants to know how easy, difficult is it for your app to be, or your model to be replicated?
Like our business model?
Yeah, it has both the question, the app and the model.
So for business model, it's an industry standard. So it's replicated by all companies. The app, the design or the usage of it isn't hard to replicate. We do have proprietary IP around our algorithm, which calculates and analyzes a patient's biomechanics in real time.
Okay. I go back to the jury. Do you have further questions that you would like to ask?
I may have missed it, but the IP around this, is there any? Have you patented it or the process?
Yeah, so our IP is around our algorithm, which analyzes the patient's biomechanics on just using their smartphone or laptop camera. So that's usually the most kind of engagement part of it that provides the data back to the medical provider as well, allowing them to remotely monitor progress.
Okay.
I have another question. Oh, sorry, Audrey. You want to?
No, yeah. How long before you think you really go on the market? I mean, before you get your first.
Yeah, we're anticipating the end of Q3 next year, where we'll be completed the pilots, have the commercialization data we need, and have converted those pilot hospitals into paying customers.
Okay. Do you think the 400K, 400, right? Was that 400K would be enough for you to meet your expectation and your plans?
Yeah, so our goal is to fund the next year using this pre-seed amount, which will get us to that point of commercialization. As soon as we're able to build that pipeline of sales, we're going to be able to increase the valuation of our company and really effectively grow and kind of put gas on the fire to grow.
Does the company currently have debt?
No. I paid off my OSAP too, so even the founders are debt-free.
Okay.
Any more questions from the jury at this point? No? Okay, so I may go to the audience then. I have a question about, hold on, I'm trying to find the question. Okay. What are some of the assumptions you have taken in $500 per patient in your business model? And have you worked out the economic impact of it on all stakeholders?
Yeah, for sure. So the assumptions we're taking on the 500 is the overall cost for post-op care and the number of appointments we're going to be able to save the health system transitioning to telehealth. So it's more based on the value we're able to provide over the 90 days recovery we manage, as opposed to the 6 to 12 months that they might be going for. This allows us to cut down the sales cycle and the value of our solution. Sorry, and the stakeholders question was the second one. So we have identified in the medical side, our solution provides value to the physical therapist, the surgeon, and the care coordinator and the nurse. So by working with a lot of these providers, we're able to see what data they need from the patient to help them remotely monitor progress. So the surgeon has different needs on information and symptoms that a physical therapist might not. And so coordinating that care is very time consuming for them, which we're able to reduce into seconds now. In terms of the patient, they save a lot of time and money commuting, especially if they're recovering well from home. And in terms for the hospital and the insurer, they were able to save costs and optimize the patient's recovery time.
Thank you. I will have another question from Pragya. How much part of the product application is developed? What will be the cost for the remaining of the development?
So the first half of it, the patient side of it is nearly completely developed. We're just adding more exercises for the protocol right now. The second half of it, which is the provider portal and making the connection between the two, is the remaining part. We put that to the end of it as well as we work with a lot of these providers and expand the ones we talk to make sure that we're able to get the most data out of a patient's recovery that they need to remotely monitor their progress. So it should be done with the help of the investment by the end of Q2 next year.
Thank you. Jury, we have 5 minutes left for questions.
Did you do an analysis on the cost that you will provide to your customers?
So our pilots are running that for us right now, where we're tracking how much we're saving in terms of transitioning to telehealth and also in terms of meeting recovery timeline expectations as opposed to extending them.
So you don't know yet. It's coming.
We're in the process of it, yeah. So I'll get back to you.
Okay, thank you, Hamza. If the jury has no more question, I think we can move to the third finalist. I can see Nadia and Simon already ready to present. So any final question from the jury, or should we move on? We good? Okay. So Hamza, thank you so much for this presentation, and let's welcome Nadia Ladak and Simon Godbout. So welcome, Simon and Nadia. Very soon we'll be able to see you. You are the co-founders of Marlo, a new fintech startup that has developed the first ever lubricated tampon kit. Prior to Marlo, Simon was at the Glebe Business Improvement Association, where she worked with more than 300 small businesses to champion the Glebe as a choice destination to international tourism boards. Nadia was previously a management consultant at KPMG, where she worked across a number of Fortune 500 retail clients to improve their customer experiences. Simon and Nadia are both committed to giving back to their communities through their roles as mentors for junior achievement, where they coach high school students to start their own entrepreneurial ventures and inspire the next generation of entrepreneurial leaders. Definitely entrepreneurship is in their DNA. So when I ask the question, what do you like the most about being an entrepreneur? Nadia and Simon answered, our favorite part about being an entrepreneur is the opportunity to wake up every morning and feel energized about solving a problem that we are truly passionate about. As founders, we get to wear many hats, and we love the fast-paced learning that happens with entrepreneurship. We are accountable to every single decision we make. A great program, and I think it's time now to hear more about Nadia and Simon.
Hi, everyone. Thanks for taking the time out of your evening to join us. I'm Simone, and I'm the CEO and co-founder of Marlo, and I'm joined by my co-founder, Nadia, who's our COO. And we're building Marlo, the one-stop shop for sexual wellness. We noticed that in the last decade, there's been big successes in the physical wellness space, such as ClassPass and Peloton, as well as the mental wellness space, such as Headspace and Calm. But we know that Gen Z and millennials are really looking to take a holistic approach to their health. And with the fourth wave of feminism and a big uptake in pushing for women's rights, there's been a real interest in sexual wellness, yet no brand that's been at the forefront. So Marlo is really positioned to be that go-to source of information and products for that next wave of wellness, sexual wellness. This started when my co-founder went to the gynecologist to describe the pain she felt using traditional tampons and how she felt really limited by her other option of using pads. At the time, she was taking 1 week off of the gym every month and was really limited by her options. She'd been to the doctor, and her doctor suggested that she spit on her tampon to make it easier to insert. And that shock factor blew away our team. We thought there must be a better way to solve this problem and to really empower her to live her life on her terms. So we went on to interview over 200 menstruators, and 86% of those respondents had experienced insertion pain or discomfort for a variety of reasons, from general anxiety to vaginal dryness, to a light flow, especially at the end of their cycle, and due to a variety of medical conditions. We also learned through these interviews that there's a real gap in sex education. 89% of our follower respondents in our community of over 8,000 had stated that sex ed didn't prepare them for the real world. We developed our first product, which is an innovative method to apply lubricant to a tampon to make it easier to insert. So during those interviews, we heard that people were starting to hack this solution at home, but it really felt like arts and crafts in the bathroom stall, and it was a really messy process. And so we did a lot of testing with our users to engineer a bottle to perfectly coat a tampon with each dip. And the way I describe our innovative cross-slit valve application method is I compare it to a soda cup that you would get at, let's say, McDonald's, and the little slit where you would put a straw in. It's a similar shape and format, but made of a silicone, and that makes it a more hygienic process to apply. It's much more mess-free, and it also applies just the right amount of lubricant to make it an easy process. Here's a little bit more about the specs of our product, and our tampons are 100% organic cotton, which is different than what you would find on regular store shelves. We have a plant-based applicator, which makes it a more sustainable option. As well, we source lubricant that is fragrance-free and pH balanced. Our products are manufactured in Europe and the US, and we have exclusive rights to that lubricant application design, and it all comes together in our 3PL in Toronto for fulfillment. We've also successfully received our Health Canada private label license and successfully completed lab tests to prove that both these products are really safe to use together. 93% of our user respondents that tried the product would recommend Marlo and told us that it made insertion an easy and painless process. We also heard from medical experts such as pelvic physiotherapists about how the product really helped, and they vouched for the hundreds of patients they saw every year about how it helped insertion, and this would be a product that they would really benefit from. To date, we've generated over $13,000 in pre-sales in under 3 weeks. We raised our pre-seed round of $500,000 and have also received $30,000 in non-dilutive grants. We've organically built a community of over 8,000 menstruators. We've tested our product with over 100 menstruators, and we've received those Health Canada approvals. This is also a large market that's valued to be worth over $50 billion by 2027. And in fact, 1 in 6 women experience vaginal dryness even before menopause. So it's a really large subset of people that could benefit from a product like ours. We'll begin by selling directly to the consumer on a subscription, which on our end results in recurring revenue. And for the customer, it solves that strong fear of running out of a necessity product. So it avoids them making those rush, awkward emergency trips to the drugstore. We're also able to use data and analytics to deeply understand our customers and to create a feedback loop in a way that large players like P&G aren't able to do because they have the middleman, the retailer, let's say the Shoppers Drug Marts of the world.
And so Marlo will be the first ever lubricated tampon to come to market. There is currently nothing like this out there. In the menstrual product space, there are large CPG companies such as Procter & Gamble. They own brands such as Tampax, and they're really competing on retail shelf space and price. There are more environmentally sustainable companies such as Diva Cup or Period Underwear. They're really going after that sustainability factor, but their products are much bulkier and even more painful to insert than a tampon. We also have newer menstrual product startups such as Lola. It's based out of the US, so it currently does not operate in Canada. What they've done is they've proven that the direct-to-consumer business model works, but they only offer traditional tampons. So where Marlo can really come in is with our brand new product innovation, the first to market, as well with our new refreshing brand. We are really approaching it by being a digitally native brand, which is not common in this space, by building a community and by being really inclusive to all menstruators, not just women. We're also using a unique business model, which is direct to consumer, and it's very personalized so that the customer does not have that fear of running out of product. In the long term, that business model where it's direct to consumer and personalized, it allows us to collect data and analytics on our customer, and this becomes really valuable for those larger CPG players. We've seen that Procter & Gamble, even Unilever recently acquired Dollar Shave Club for over $1 billion to have access to this data. So these large CPG players are making acquisitions in this space to have access to these communities. And that's really our underlying magic, that community feedback loop that we're building. Our blog is a huge way that we've been able to organically build our community to date to over 8,500 people. Our blogs are SEO ranking on Google with over 100,000 impressions. And our customers are saying that we're really becoming a thought leader in this space. They're turning to our website, to our blog, to our education to learn more about their bodies and to be empowered. And so why now? The femtech industry is booming. It's projected to grow to over $60 billion by 2027. As well, COVID-19 has really accelerated the growth of e-commerce. 66% of Canadians have increased their online shopping habits during COVID-19, and this is projected to continue even post-COVID-19 as well. And lastly, with the fourth wave of feminism, there's been an overall growing support for women's sexual health. People want to learn more about their bodies, about the products that they're using, to take that approach of holistic wellness. We're going to be starting by targeting the young professional, someone who is 18 to 35. They really are looking to shop online. They value the direct-to-consumer and their busy lifestyles, and they look for really purpose-driven brands, ones that align with their values, like Marlo would. We know that over 50% of the population will menstruate at some point in time, and so there's a huge market that we can go after this as well, including the Gen Z teen, as well as a mom who would recommend this product to her child. Our go-to-market plan is very unique in comparison to some of the larger CPG players. We're really focused on community building and being digitally native. We've already successfully reached these individuals through our organic content strategy, and we'll continue to pursue that. As well, we will be building a referral program. We've heard that many people through our research have recommendations for the product from their mom, their sister, or a friend. And so using this referral program, we'll really incentivize those positive word of mouth recommendations. As well, we'll be partnering with lifestyle influencers, which we've already had interest from, to share the product on their stories, on their platforms, with their really engaged followings. As well, partnering with campus ambassadors. We've seen a lot of success through our strategy. We've already spoken at over 10 campuses across Canada, where we can talk to sports teams, to sororities, where they have these really tight-knit communities and the word travels fast. As well, we're able to do targeted keyword ads. So the great thing about this space is that people are searching, "my tampon hurts," or "how to insert a tampon," and we can be the first ad that pops up when people are searching these terms on Google. In terms of our financials, we have two products. We have a one-time purchase as well as a quarterly subscription where the customer receives 3 lubricated tampon kits every 3 months. Both have healthy margins of 30%, but this is just with our first order size. So as we continue to place larger order sizes with our manufacturers and we can achieve economies of scale, these margins will continue to improve. What's also great about this space is that there's not a lot of price sensitivity as it is a necessity product. So when we did our research with our customers, 68% of them didn't even know how much they spent on menstrual products. To calculate our projections over the next 3 years, we looked at our marketing budget that we have allocated, as well as the conversion rates on the different marketing channels and strategies that we'll be using to get what our revenue and our profit could be. This is only with our first product, but we plan to be a one-stop shop for sexual wellness. So these projections will continue as we introduce new products into our product lines and we expand to new geographies as well. Another great thing about this space is that there's a huge potential for lifetime value. The average menstruator has their period for over 39 years. And so there's many times throughout their cycle that we can capture them. And the cycle will continue as a parent recommends the product to their child as well. Our team experience range from management consulting to asset management and branding. We actually have experience launching D2C brands, which is great in this space, as well as doing branding for Gen Z millennials who are looking for that digitally native brand. We've participated in different accelerators. We all attended the Ivy Business School. And what's really great is that we deeply understand our customers because we are that target demographic. And that's been proven with the growth of our community to date, organically with no marketing spend. And we're backed by an incredible team of advisors, people who have retail experience, such as the former president of Toys R Us, people who are medical professionals or menstrual equity advocates, all the way to manufacturers and growth experts as well. In terms of our key milestones, we raised our pre-seed round of $500,000. We received our Health Canada approval, and now we're really excited to gear up to launch our product next month in December to have it be available for purchase by anyone through our online e-commerce store. And shortly after, we'll be expanding to the US and then continuing to introduce new products such as a standalone lubricated tampon. Our ask today, we are looking to meet any strategically aligned investors who are here today. We're planning already for our next raise in spring 2022, as well with the upcoming launch of the brand next month, really encouraging people to follow along, to share the launch of the brand with our network. Thank you so much for listening today, and we're open to any questions.
Thank you, the Marlo team. It's time for the jury to ask questions.
Sure, thank you, very interesting. You mentioned, I mean, my first question would be about regulation, and I don't know, I mean, I'm not knowledgeable, but I'm sure you are. What kind of regulation you went through, etc. And you mentioned also expanding to the US. To what extent it's a different regulation that you'll have to face? That would be my first question. Second question about data. When you mentioned the data you collect, what kind of data do you collect? And maybe I pause there to also pass on to other questions from the jury.
Sure. I'll take the first one here on regulations. So it was interesting to learn that tampons are Class 2 medical devices under Health Canada. So there's a 4-class risk scale, where Class 2, which is the same as rubber gloves and condoms, so quite low on the risk scale. What has to happen is that our manufacturers have to have Health Canada approval, which they already do. And then we file a private label license under their licenses to be able to sell. In order to do that, we also completed lab tests such as vaginal irritation and skin sensitization to prove the efficacy of the product. And so we successfully went through that regulation process and that lab testing process to be able to sell. And then for the US, it's a quite similar process, except it's regulated by the FDA. And so we're already going through that process as well. We actually work with regulatory consultants who help us navigate that process in order to gear up for our launch in the US coming up next year as well.
And on the data piece, what we're really looking to do is do cohort-based analysis to learn more about how people are using the product. So lots of questions around sort of quantity as well as absorbencies. That's sort of two key pieces to the efficacy of the product. Also, it allows us on the marketing side to really optimize our marketing spend. So to understand what kinds of customers are the stickiest and have the longest LTV. And from there, really building a feedback loop around what kind of future products those cohorts are looking for. And so we've already had an outpour just through our social media community for suggestions on improvements they want to see in the space. But truly it's around sort of the product use behaviors, as well as then optimizing our marketing.
What kind of
I have
data?
a question, I guess. Sorry, go ahead, Peter.
I'm sorry. I was just wondering what kind of data would be accumulated that might be somewhat sensitive regarding your customers.
Yeah, I mean, legally, everyone has a different definition of sensitive, but we would be following the regulations around data collection. And basically it's very consent based. And so that would be something that we'd be asking the customer's consent for. And we do basically, the way we've set out our system is that they can choose to share sort of what they feel comfortable sharing.
So it's
and a
always
lot of
up to, right? Yeah, got it.
A
Okay,
lot of
thank
it
you.
is based on the account portal of how they interact with their subscription. So they have a lot of control to manage that subscription for themselves. And so that's really where we'll be able to see how they're buying and purchasing the product based on how and when they're choosing to receive their shipments.
Understood. Thank you.
I had a question, I guess, on pricing strategy or thoughts. If I look at the way you're pricing your products, single purchase versus quarterly, it's really the same price. And I guess, any thoughts there on optimizing that? Because I do think if someone's committing to a bigger dollar spend, there should be some sort of unit discount. And secondly, I guess discounts for repeat customers. I guess maybe some of that will tie into your cohort data, but tiered pricing as well, volume based or commitment for longer than quarters. So just, I guess, looking for your thoughts there and any thinking.
Mm-hmm. Definitely. No, great question. One thing I forgot to mention is when the customer purchases the quarterly subscription, they get free shipping. So that's kind of the incentive to get people to do that quarterly subscription and the savings that they would get. Whereas if they do the one-time purchase, they're responsible for paying for the shipping. So that's definitely one incentive. In terms of discounts, we haven't planned any discounts for repeat customers. but we have done a referral program so they can get discounts on future purchases if they refer friends and are really enjoying the brand, as well if they come through a channel like being referred by an influencer or being referred by one of our campus ambassadors, they will get 10% off through those codes, which will allow us to track which strategies are doing the best as well. So those are kind of the ways they'd be able to earn a discount if they wanted to for their purchase.
We do also offer them to purchase just the tampons and just the lubricant if that's something that they would choose. And so there is a bundle and save discount of 10% when they buy both of those items together.
And I'm assuming it's too early to kind of have cohort data on repeat business at this stage.
Yeah,
that's right. We'll have more info once we launch.
Yeah, because I think that's, you know, as you highlighted, kind of the secret sauce that, you know, if you were to exit, people would be interested in getting behind. There was another slide in your presentation talking about the 39 years life cycle. I think it sounds like that's a bit up and down. You know, obviously you're targeting half the population, but have you done any specific kind of cohort or demographic data to see whether the market's kind of growing or shrinking given the demographic age bands over time? Because we talk about, you know, reaching a point when population will shrink, especially in developed markets. There's obviously, you know, differences across generations in terms of size of cohort. So just wondering if you've done any more analysis there.
Yeah, really, the number of customers is less of a problem in this space. And for us, it's more so the focus of who our customer is. So from the get-go, we've decided that we aren't a product that we market to everyone. We've really zeroed in on those niches of the young professional. And so how we sort of inform those key phases, I guess would also be helpful to know, is we talked with brand ambassadors at P&G, and they told us that there's really key phases in life stages where people are willing to change brands, especially in this space. And so that one first key stage is when people move out of their family homes and they start making their independent purchasing decisions. So that's why we're really starting by going after the young professional. Then there's the sort of anxious user who's using this product for the first time. But we understand that obviously their parent is a really big influence in that purchasing decision. So those two sort of groups work together, with a parent being a big influencer. And then on the note of sort of global trends in this space, one thing that we've seen is there is, especially historically, there's been a lot of stigma in developing countries around the use of tampons. In more urban areas now that are sort of following along in more developed countries' footsteps, there's been an uptake in that product, but it's been slower because it's a little more uncomfortable to insert. So our product slots in really nicely to that transition phase of developing countries in urban areas specifically, starting to use more of those products.
Great, thank you.
So what's your strategy to go to market? Do you want to be only a pure digital player, or ultimately do you want to penetrate the Shoppers Drug Marts afterward?
I think we're starting by going digital. We do know that larger players have made acquisitions in this space of those D2C brands. And so really we know our magic and our secret sauce will be that data and that personalized engagement with the customer. But I think we're definitely open to doing retail in the future as well with Shoppers. We know that Shoppers, Rexalls, they place such large orders. And so they'd be a really great source of reliable revenue. And so we're open to that in the future, but definitely starting with that digital native brand.
And we've had a lot of interest as well from players such as gyms and hotels. And we think of them as more sort of discovery points for new customers to learn about our brand. And we would ultimately be trying to redirect that traffic towards our own website and to really help them create accounts on our D2C channels.
Do you ship across Canada for now?
Correct, we go across Canada.
Do you contemplate once you, as you want to expand to the US, what about the logistic?
So the logistics are actually easier in the US, which we're really excited about, especially from a margin standpoint. The Canadian population is spread very widely across the country because we have so much area to cover, whereas the US fulfillment is actually cheaper. And so our margins will increase quite drastically because we are on those subscriptions eating the shipping costs. Those will be cheaper in the US and our margins will actually be much better once we expand there. And we have fulfillment partners that we've started to have conversations with. So lots of options as far as fulfillment goes.
Thank you. Lorraine, any further question? Peter? No? Okay, so we have some time.
Maybe one last, do you spend a lot on Google Analytics? You mentioned it as a part of your marketing plans. Because you have to, I mean, that's where you have to grow, right? To start with, because to promote your website, right?
Yeah, sorry, what was the first part of the question about analytics?
Do you spend a lot on Google Analytics?
Spend. We spend basically how we've thought about the analytics side of things is, well, Nadia's background, she used to also work at TELUS Digital, so she has a lot of experience optimizing those analytics, especially the flow of how people navigate our website, but specifically to Google Analytics as well as Facebook ads. We've also hired external consultants who have scaled brands from $0 in revenue and really set up those early processes to now they're doing over 30 million in revenue per year. And so we've hired those experts on a consultant level to really help us navigate all the data on a weekly basis and then to optimize our decisions based on that information.
Thank you.
Okay, well, the jury takes some time to think of further questions. I can move to the questions from the audience. I have questions from Christian and Hervé that are quite similar, even though framed differently. Looks like any competitor coming with a similar product with another lubricant, of course, could eat the dinner that you have prepared and the market you have built just by being a little cheaper. Risk considered?
That's definitely a risk. I mean, it's a risk with a lot of businesses as well, but what's the pricing consideration is interesting because we learned that a lot of people, and this is very focused on our target demographic, there are people who don't have access to menstrual products because price is a barrier for them. But for our specific target demographic, price is something that actually fell to be one of the least important considerations for them. Ahead of that was really convenience and reliability and comfort. So those are sort of the most important ways that they rank their business or how they spend their dollars. And then really for us, the magic sauce is that community. And so really being able to return value to our customers through education and to build that relationship with them so that there's that sense of loyalty is even more important than the product itself.
And on the kind of competition side, we have seen bigger players just rather focus on acquiring D2C brands as opposed to developing the product themselves. So I mentioned the example of Unilever and Dollar Shave Club, but there's also Sleep Country Canada who acquired Endy. So they're really focusing on acquiring players who are making those loyal communities and have that data as opposed to developing the products themselves.
Okay, question from Thierry. How did you use the 500K? Do you have enough for the mass product launch and going forward?
Yeah, that raise takes us all the way until our next raise in spring 2022. And we've used it to, part of it is a lot of it will be our marketing once we launch, but a lot of it was to order our inventory and to get those regulatory approvals and to get the lab tests required to prove the safety of the product.
Okay, Rachel is asking, is there any IP protecting on this? Is your class 2 regulation on you or the manufacturer? And who is the manufacturer?
Yes. So in terms of the IP, we right now have exclusive rights to our bottle design that we've made with our innovative cross-slit valve. We're the only ones who can use that. We've made a strategic decision not to file a patent for this product. We can file a patent in the future for our standalone product, but we do know that the value is around the brand and the data. And so we've prioritized our funding towards marketing and the branding that we're going to be doing. As well, we can potentially file the patent in the future with the standalone product. And then on the question for the manufacturers, our manufacturers are based out of Europe. They're leading in tampon manufacturing, as well as based out of the US, leading in lubricant manufacturing. And in terms of the class 2 falls on the manufacturer, so they take on the liability within the product, and we file a private label license under their license to be able to sell the product.
Okay, I have a question from Milou, and I will turn myself back to the jury after this one. Where's the name coming from, Marlo?
The name, we started by actually thinking of what this person would be if it wasn't a company, who they would be. And we wished when we were younger that we'd had an older sibling or friend to really tell us like it is in a no BS way, but well-informed manner, sort of around all things sexual and menstrual wellness. And so we actually went through a baby names list, and Marlo was one of the names that stuck out for many reasons. We liked that it was gender neutral, it was original. Our graphic designer at the time loved that the M and the W had really nice symmetry at the start and the end of the word. So lots of reasons. And then it really fell to our community. It really resonated with them. And that's the reason that we stuck with it.
Awesome. So now I'm turning myself to the jury. It's your last chance to ask questions before deliberations.
I'm guessing the four of you were classmates, I guess, at Ivy. How did you decide to come together, and how did you decide who would take which role in the company?
Yes, we were all classmates at the Ivy Business School. We actually did an entrepreneurship program together in our 4th year, which is kind of how we met, but we've known each other since our 1st year of school, which is really exciting. We've known each other for over 5 years now. And in terms of our roles, we actually all had natural strengths, which was really awesome. Our CMO has experience in photography and visual design and graphic design. Our CFO worked in an asset management firm. I had experience more in the data and analytics, and Simone had a lot of external facing experience and went through that accelerator program. So it just worked out well that our natural strengths and experiences lended itself to those roles.
That's great.
Joy, Peter, are you good with your questions? Yes. Okay. So I think time has come, dear jury, for you to retire and deliberate. You have a lot to think about. The presentation were awesome tonight. A lot of great questions and we got all the answers we wanted. So go for it. And I'm looking forward to see the result of all that. In the meantime, Felipe, do you have some advice to give to us?
No, just go ahead with the other questions from the participants to all 3 startups, and can go with that. Yeah.
Okay, so should I introduce now Rachel?
Oh, I guess we can exhaust any other questions that I have from the participants just before we vote for the audience award, and then we're going to have Rachel. Okay, so are we going back to project number 1, to the first presentation? Yeah, and yeah, we can make one question for each group and then go for a few minutes on that. Okay. Okay, so let's find a question for Algo Bio. Let me find those questions. Okay, so Scott is asking, what is the uniqueness based on? Because a possible path to growth is to retain that, but then partner with an existing power to get access to market.
So who wants to answer? I'll go by you.
Yeah, I can take that one. So as far as the uniqueness goes on our product, most flame retardants used in industry use a specific chemistry to limit the to block oxygen from getting to the material. And our flame retardant uses a somewhat different chemistry where it forms a char layer at very high temperatures. So that's starting to go into the industry now, but very new. And I think that's why we have that competitive advantage of having this technology ready at such an early stage.
Okay. I will ask a second question. So 2 questions per project. Jason is asking, do you see any application for your product beyond the textile market, for example, vehicle components?
I can answer that one. So absolutely. Our initial target market was for vehicles. That's something we're definitely looking into. We've done a number of testing on textiles that are typically found in the interiors of cars, sorry. And there's very good adhesion to it, and the properties are there as well. So that's definitely something we could look into. Based on the industry, there are a number of standard tests that needs to be passed for the product to be adopted by the given industry. The most important one is still the vertical burn test, for which we have passed the criteria with flying colors. So there could be adoption in those markets. We're currently addressing our beachhead market, which is the textiles, because the carpets and the manufacturers, because we have key connections there, and we have insider knowledge that the market is really looking for these solutions in that specific area.
Okay, thank you. I will now ask 2 questions to Stavel. Ansar, if you could answer. One question is from Cedric. Are you using any leverage from government programs?
No, we haven't yet. A lot of the digital health ones are not open yet that we're looking to connect with. So early next year, we're going to reapply to a lot of the programs.
Okay, and the second question is from Anthony. What are your plans for marketing sales over the next 24 months?
We have a direct to hospital B2B sales channel. So a lot of these sales cycles tend to be a bit longer. So we're getting a head start on them right now, entering these institutions in the form of their innovation centers and with their key innovation officers, and facilitating those relationships from pilots all the way to sales and full-on customers.
Okay, thank you. I will now turn myself to Marlo, and I will ask a question about, from, again, Anthony. What is your profit margin?
So right now our profit margin is around 36%. This is just with our first order with our manufacturer. So as we continue to place larger orders with the manufacturer, we'll be able to achieve lower costs, which will continue to improve our margins.
Thank you. Emily is asking, can you tell us what other products you are planning to commercialize?
So the next product on our roadmap is a standalone product. And so that would be a tampon that comes pre-lubricated. The reason we are waiting to start the development on that is to really receive feedback on the current launch. And so that will help inform the design of our next product. Another key piece that we've seen that has been of interest from our community is a more sustainable product. And so we're really looking, our end goal is to make the first flushable tampon. But in the meantime, we've set up roadmaps in really increasing the sustainability of our materials, as this is something that's been a really big focus for our customers.
Okay. Let's do one more round of questions and then we move to the next step. So because you are there, Marlo, we'll stay with you. Karen is asking a question about the safety of the ingredients in the product. Can you comment on safety?
Yeah, this is something that was definitely a priority for us. And because it is such a heavily regulated space, there are very tight regulations around what is allowed in the product. At every step, we took the most safe ingredient based on the research out there. And so our product is 100% organic cotton, with a bio-based plastic applicator, and the lubricant is water-based, pH balanced, and free of fragrance. And that's why we also did complete those laboratory tests to really test the safety of those two products being used together. So that's where we did the skin sensitization test and the cytotoxicity test to really prove that everything is safe to use together.
We also have gynecologists and pelvic physiotherapists on our team of advisors who went through and vetted all of the ingredients in our products as well.
Thank you. I'm going back to AlgoBio. There is, Punit is asking, compared to your other smaller competitors, you may have a different formula, but yet a bio-environmental friendly product. What is your USP? You mentioned powder form as one, but that seems easily replicable. So could Anneke or Elias comment on that?
Could you repeat the question, please?
Compared to your other smaller competitors, you may have a different formula, but yet a bio-friendly product. What is your USP, your unique selling proposition? You mentioned powder form as one, but that seems easily replicable.
Yeah, so other than being in a product powder form, like I mentioned, our tech works in a little bit of a different way. So that is definitely of value because it provides a little bit more safety than the typical industry standard flame retardants currently used. And on the other side of things, over 90% of the products that go into our flame retardant come from renewable resources. So that's kind of another value proposition that our customers can use when marketing, showing that they are using like a green solution.
Thank you. I'm going back to Nadia and Simone for Marlo. What's the next 3 products in this space that you have identified? Do they all fit the DTC business model? That's a question from Scott.
So the next 3 products in our roadmap will be that standalone product, then innovating on the sustainability. And from there, we've also identified opportunity for pain relief within the CBD space. And so either CBD infused lubricant or also a CBD infused tampon. There's a lot of research going into that space right now. So we're watching that closely, and they do all fit the D2C model.
Pragya is asking to Marlo again, also, do you have any plan to beat price of competitors? I felt that the product is expensive as its current rate. What does your analysis say?
So right now, there's a competitor named Lola who just sells traditional tampons. They're priced at $14 for direct-to-consumer service of tampons. As well, if you were to buy tampons and lubricant from the drugstore, each one would be about $10, which is quite similar to our price point of $20. And as well, you're getting that convenience of the direct-to-consumer. So we're quite in line with tampons that are delivered through direct-to-consumer, not necessarily the ones that you get at the drugstore.
And our offering of just ones that would be sort of the direct competitor with Lola sells for $13. And so that's actually cheaper than their offering.
Thank you. Hamza, I have one question for you. I think you answered partially, so maybe you can answer to the other half of the question. What is your revenue model? Like, who pays you and in what way? I think the what way.
Yeah, our revenue model is directly to the hospital. It's the highest payer that can provide value to us, and it allows us to kind of avoid these long-term ambiguities with the patient. So we charge the hospital $500 for every patient's recovery we manage for 90 days, along with the annual license, depending on the number of providers within that hospital. That allows us to, again, maintain cash flows throughout the year, but still meeting the industry standard in how business is done with hospitals on average.
Okay, thank you, Hamza. And now AlgoBio. Question from Pragya. What is your revenue projection for the next 1 year, 2 years, 5 years? How much funding do you need? Basically, when do you predict to become a profitable company?
So like I mentioned, we're hoping within the next 6 months to do that 100-kilogram pilot batch with our first customer, and that would bring in a few $1,000s of revenue. And then from there, we're hoping to build relationships with key partners. So rather than go for many customers, we're hoping to have a few bigger customers. So those batches can grow to as big as 100,000 kilogram batches, which would then bring us a bigger revenue of a few million.
I'd also like to add that in terms of price point, like we mentioned, our product is much cheaper than the typical alternative in terms of production and the sourcing of the raw materials themselves. So we have a large profit margin upon sale of our product, which would definitely help us become profitable at a faster rate.
Thank you. I believe we have come to the end of the questions from the audience. Felipe, maybe you can advise us of what's next. What do we have to do as an audience now?
Sure. So next thing we will do here is basically vote for the audience award. So everyone that is here on the line is going to be able to vote. I just have to finish one technical side here. Just give me 1 second, and I'll be able to launch the poll here. So we'll be able to basically to vote on your screen. So I'm just launching it now. So you can vote on whoever you think deserves to win the audience award. So I'll give you a minute for everyone to vote, and then we'll announce the results later on together with the Grand Jury Award.
So, Felipe, how long does it last, the poll?
Yeah, I see that it stopped growing here, so I'm going to end now, and the results will be announced later on. So with that, Veronique, I can pass it over back to you, so I can introduce Rachel.
Okay, so I'm very pleased to introduce Rachel. Every year we have this entrepreneur challenge, we have a winner, and we always wonder what happens next, you know, because from one award to the next, in between, there's the need to develop the business and to continue engage with customers. So let me introduce Rachel Bartholomew. Rachel is the CEO and founder of AAGEF Health that you maybe have been exposed to last year. And Rachel has been involved in the startup community for the past 10 years, working in various roles in small businesses, venture capital, innovation labs, and ecosystem partnerships. She's currently working on her second business, AAGEF Health, focused on creating a medical device for women with pelvic-based cancers and diseases after her own cervical cancer battle in 2019. Her last startup, an automotive e-commerce software, achieved an exit in 2019 and worked with large corporate clients such as eBay and Canadian Tire. Rachel is a graduate of the Masters of Business, Entrepreneurship and Technology program at the University of Waterloo. And after graduation, she became an entrepreneurial advisor to over 250 formation stage businesses. She has worked as a professor in entrepreneurship for quantum computing, an innovation manager at a large Canadian financial institution, and helped restart Laurier University's incubator program. Rachel, I think you need a lot of vitamins after reading your bio. I'm already tired, so I can't wait to listen to your story.
Oh, thank you, Veronique, and thanks for having me back, and congrats to all the companies that pitched. I know at least 2 of you, I've come across you before, and Hamza, it's great to meet you. We're going to connect later as well. But nice to meet you all. Nice to see everybody. I'm located in Waterloo, Ontario. So for my AAGEF group, okay, Waterloo represent. I know that the winners have been chosen, so I will be brief and quick, but we were a women's health company that was established in 2020. So we're just under 2 years young, and it was actually created out of my fight with cervical cancer. So going through my radiation, I went out, I pitched to a number of the radiologists and oncologists that were treating me, and now are a part of of our clinical trial team, which I'll talk about. But it's been a whirlwind of a year. We're innovating on a product that was created in 1938. So not a lot of innovation has happened into this space. And essentially we're creating a pelvic rehabilitation device for the 1 in 3 women who are experiencing a pelvic health complication in their lifetime. So our device collects the first quantifiable data set on the pelvic floor, and we provide 3 different therapies with these biosensors that keep track of progress, adapt treatment plans for pelvic health complications, and make more comfortable rehab experiences from home. So our involvement with this group, we found the pitch on Founders Beta and decided to apply. And we were really at a critical point of converting our company from a direct-to-consumer product that was, focused on wellness to a full-blown medical device company. And, now we were getting ready to go through at that point a fundraise. So it was all hands on deck, really trying to figure out our strategy and growing our kind of medical pathway. And this community really brought out a full diverse amount of backgrounds and connections to a broad network. We were actually trying to get connected into the French and France community specifically, because pelvic health is actually something that France is leading the charge globally on. And so it was something that was really shocking for me and something that this community was able to provide to us. And we did end up winning the Audience Choice Award on the last year presentation. And we got lots of mentorship afterwards, made a lot of connections, kept in touch with a lot of people. Veronique was amazing to talk to, as she has a lot of history in this space as well. So it's been great. And so afterwards, we went out and actually raised 1.2 million in investor funding. We also raised an additional 500,000 on top of the 700,000 we already had in non-dilutive funding. We built our team probably triple the size. We have over 500 patients currently in testing with us, as well as 60 active clinicians. Our device is being adopted into the pelvic floor therapist educational system. We were listed as one of the top 5 femtech companies globally out of 1,500 companies, leading the charge in pelvic health. We currently have 6 clinical trials in various stages across Canada with different patient groups. So really trying to fill the gaps in research that unfortunately exist in the women's health space. We're on track towards Health Canada and FDA approval. And really focusing on R&D and building out our database on these specific points for women's health, that can be used in research further down the line for different products. And so just a couple tips to throw out there as we move into the winners announcement. So for those of you who are in the audience, maybe looking to get into entrepreneurship or startups, put yourself out there, do these types of pitch competitions. Be a part of these types of communities. You never know who's in the audience, who's going to be able to help you build out your compelling story. So you heard a couple today, take notes and feel free to kind of learn off of the companies that are out here doing it. Get mentorship and be open to help and criticism. Don't be afraid to take risks. Taking a risk doesn't need to be jumping off a cliff without a parachute, I always say. So you can prepare yourself for those types of situations. And then get creative on how to get your business through the tough times, right? So a lot of us are going through these. Get involved with communities, mentors, advisors, get out and pitch. Be able to fill some of these gaps and scrap out what you can in terms of resources to get over what we call the valley of death sometimes in the startup world to get us to a point where we can actually make money and sustain ourselves. So thank you again for the opportunity. It's been a whirlwind since our win at this pitch competition, and good luck to the winners. And I'll pass it back off to Veronique.
Thank you, Rachel. So well said. I really get it that it's a journey independently of who wins today. The journey continues. It's a community. And I want to say, Rachel, you embody what people say about entrepreneurship. The trait of all the entrepreneurs I interviewed was to solve problems and to impact people's lives. So really, it's inspirational to hear your story, to turn something that could remain a tragedy as a real opportunity to impact positively so many lives. So good for you, like very, very inspiring. And I'm sure you're like me and like us, you want to know who has won the awards tonight. Because still there is a thrill. We always like to win. So we will present the Jury Grand Award and as well as the Audience Award. Bruno will obviously present the Audience Award, and I will start with the Jury Award. So the Jury Grand Award is, Felipe, do we see it?
Yep, you can go ahead and say it.
I don't know.
Oh, okay. So let's just advance a slide and then it will be a surprise for everyone.
Yes. Okay, congratulations, Algo-Bio, Anneke and Elias. You made it tonight. That's the Grand Jury Award. Congratulations. Do you want to say something?
It's a real honor. Thank you so much. I honestly really think that the competition is really tough. I think both of your startups are very inspiring, and I don't want these to sound like empty words. I really thought, I didn't know if we were going to win because I thought your products was really great. So it's thank you so much. I'm very proud and very happy at this moment.
Anneke, do you want to add a few words?
Yeah, no, Elias said everything, but I think also not only the award, but just meeting everyone is so inspiring, and making these connections is really valuable. So thank you for this opportunity.
Congratulations. We are all cheering for you, and we wish you great success. And I hope you'll keep relationship and mentorship with all the entrepreneurs that were racing tonight, because you can help each other. Bruno, time has come for you.
All right. Okay. Thank you, Veronique, and congrats again to all of you, because the three companies, you know, we heard about tonight were really outstanding. Each one of you are completely different at different stages, but you're all inspiring, and you know, the jury had to make a choice. It was probably a tough decision. Same with the audience. So the winner of the Audience Award of the 2021 AAGEF Ontario Entrepreneur Challenge is and it's Algo-Bio too. So congratulations again. Well done. You've got the both awards. And I would say that yeah, I think you've got a great product with you're addressing you know, sustainability issue with and that's probably what seduced both the jury and the audience. Once again, if you want to say a few words, feel free. Otherwise, we'll move on. And
I want to thank everyone in the audience for voting for us. Thank you so much. This is a very good night for us, and thank you again.
And you're very welcome. And remember, and that's really for all of you. But like, you know, like Rachel put it, you know, really well. You know, you made connections tonight. So people will reach out to you, or you feel free to reach out to the people in the audience, and everybody is here to help, and they want you to success. So thank you all again. And before we move on to the, you know, to the second part, which is the networking, so we can all meet and you know, meet face to face, so to say, in the breakout rooms. I would like to really thank everybody again, and to congrats you all. We'll see you next year for the Entrepreneur Challenge, which we will start to prepare very soon. And until then, we will resume our monthly events. hopefully in person. And for the moment, enjoy the networking. And back to Felipe, who's gonna send us to the breakout rooms.
Okay, great. Thanks, everyone. Thanks to our sponsors here. We have also the contacts if you want to take a photo of our finalists, if you want to get in touch with them. Let me just give you a second here. I'll be open the breakout rooms so everyone can go to the networking part. So just a few people leaving. Just give me a second for able to create the rooms correctly here. All right, so I'll open the rooms here. So it'll be 15 minutes basically of networking. Then you'll receive a message in the last 30 seconds. You'll be back here, and then I'll send you again to another 15 minutes in groups of 4 or 5 people. So have a great